Hello, my name is Talisa Ramirez. I am in BSN 225. I will be doing the ophthalmic medication administration video. I have on my correct badge, correct scrubs. I have my skills here, but I only have one pair of gloves, so I will be reusing these. And I do have some eye drops that I just bought from the store because my skills kit didn't have any, and they said that we could buy some. I'm going to get started. So first, I'm going to check the provider, look at the provider's order. Then I will state the 6 rights of administration, which are right dosage, right documentation, right patient, right time, right medication, right route. Okay, I will look at the EHR. It says that the medication is Tumlol, 0.25% solution, 1 drop in each eye, 2 times a day. Okay, from there we would do any dosage calculations, any conversions if we have any. In this case, we do not have any. From there, we would take all of our supplies into the patient's room. You would knock on the patient's door, provide patient privacy. Hi, my name is Talisa Ramirez. Can you tell me your name and date of birth? Okay, you will verify that on the armband. You will also verify that on the medication as well. This is the second medication verification. Okay, from there, I am going to make sure that there is no family in the room to provide my patient privacy because you don't want to break HIPAA. Okay, so, Mr. Jones, like I said, my name is Talisa Ramirez. I'm going to ask you a few questions first. Do you have any allergies to food, medication, or seasonal allergies? Okay, no allergies. Okay, so Mr. Jones, like I said, my name is Talisa Ramirez. So I'm here because your doctor ordered some ophthalmic medication, some eye drops, and he wants us to administer those eye drops. Is that okay? Do you have any questions? Okay, no questions. Okay, so I'm just going to tell you a little bit about the medication. So this is Tumlol. This is a beta blocker that will decrease the pressure in your eye. This is the gel form, and we are going to be administering 1 drop in each eye. Some of the side effects to this medication are slight burning sensation, irritation to the eye, sensitivity to light, temporary blurred vision. And some of the adverse effects to this medication are chest pain, fatigue, and trouble breathing. Now, if you experience the fatigue, chest pain, trouble breathing, please let me know so I can help you. Okay, do you have any questions so far? Okay, so sometimes patients do want to administer the medication themselves. In that case, we need to get the approval of the doctor, and then we need to check the state of the patient. Excuse me. And when we do that, the nurse still needs to tell the patient the side effects and the adverse effects of the medication. And the nurse also needs to be there to supervise the patient giving themselves the medication. Okay, so what we're gonna do now is I'm just gonna clean your eyes first, and then we'll move into administering the medication. Do you have any questions before we start? Okay, so my patient is in a chair, in a comfortable position in the chair with the neck already hyperflexed. So I'm going to perform hand hygiene, place on my gloves, Like I said, my patient is already in the chair, comfortable position, neck hyperflexed. Okay, so what I'm gonna do first, I'm going to wipe your eyes. So I'm going to, with my non-dominant hand, I'm going to wipe the eye from the inner cantha to the outer cantha. Okay, you would fold it over. And we're going to do the other eye, inner cantha to the outer cantha. Okay. You would dispose of that. Now, I want to note that my patient does not have any crusty eyes. So just that wipe is enough. I would remove my gloves, perform hand hygiene, apply new gloves. Now that I have applied new gloves, I want to check the medication again, verify it for the third time. And now we will start with applying the drops. Do you have any questions so far? Okay, so now what we're going to do, I'm going to start by applying the drops. So I am going to get my drops. I'm just going to talk you through what I'm doing as I'm doing it, okay? You let me know if you're uncomfortable at any point. So I'm going to place the napkin under the cheekbone, placing my thumb or your forefinger under the lower lid, below the lower lid, exposing the conjunctiva. Okay, can you look up for me? I'm going to rest my hand on the patient's forehead gently. Can you look up for me? Okay, I'm going to have my drops 1 to 2 centimeters away from above the conjunctival sac. Administer 1 drop. Okay, then you want to apply pressure to the nasal lacrimal duct for 30 to 60 seconds. Okay. Can you blink gently for me? Okay. So now we will flip the towel and do it to the other side. You're going to put it under the cheekbone here. Use your thumb or your forefinger to gently expose the conjunctiva. Can you look up for me? We're going to place your hand on the forehead. Hold the drops 1 to 2 centimeters above the conjunctiva. 1 drop. You place your pressure over the nasal lacrimal duct for 30 to 60 seconds. Okay, can you open your eye and blink a little bit for me? Okay. Okay, so now, do you feel okay? Okay, so now I'm going to remove my gloves. Do you need anything before I leave? Okay, no. So I'm going to remove my gloves. I'm going to perform hand hygiene and document.